Right now, we're only testing a certain subgroup of people, so the case count is far lower than the actual number of cases in our communities. So that's the first thing. The second part of that, why not just look at the case counts? Well, it's not just the amount of virus around in our community that matters, it's the impact of that virus. And there are better and different ways to measure that. The first one would be how many hospitalizations we have, not just for COVID lung disease. Even if their lungs aren't severely affected, often their other medical problems can get worse and they can end up in hospital. We also look at the number of people in ICUs. It's important because it really does speak to the severity of the disease, and also because ICU beds in every health system are very few compared to general beds. We want to know and be able to tell people how severe the disease is when they get it, but also we want to be able to plan for those very few beds. Instead of looking solely at the number of cases, it's really important to look at what percentage of the people getting tested are positive. And if that number is still high or going up, it's pretty darn sure that we haven't reached the peak of spread of virus in our community. So that percent positivity allows us to standardize across how many tests are done each day and look at what the percentage of positive people is in our community, recognizing still that because we're doing less testing, that we're still severely underestimating the real number of positive people in our community. Wastewater, including sewage, comes from humans, as we know, among other creatures. And that wastewater has the ability for us to somewhat measure what the virus level in a given area is. What exactly it means and how much background noise there is still debatable, but certainly in some parts of the world, especially as we ramp down testing, it may have a more and more important role in helping us to get early signals of when we may want to look for virus in our communities and start testing more in a certain area. So right now we've gone from using one thing to look at to having to measure 4, 5, 6 things, but we still have some hope of using all those other numbers and a little bit of common sense in order to get us through these next number of weeks.